Which disease is transmitted by the bite of a rabid animal? Anthrax, leptospirosis, rabies, or tetanus? Rabies. It is present in the saliva of infected animals and is transmitted via bites or scratches. Which bacterial disease causes lockjaw, botulism, tetanus, tuberculosis, or leprosy? Tetanus. It causes sustained muscle contractions, especially in the jaw and neck. Which bacterial disease causes a characteristic whooping cough, diphtheria, pertussis, tuberculosis, or pneumonia? Pertussis. It is characterized by violent, uncontrollable coughing fits, followed by a high-pitched whoop sound during inhalation. The disease is most dangerous in infants and young children, and vaccination with the DTaP vaccine is the most effective preventative measure. Which bacterial disease causes a grayish membrane in the throat? Scarlet fever, pertussis, tonsillitis, or diphtheria? Diphtheria. Corynebacterium diphtheriae produces a toxin that forms a thick pseudomembrane in the airway. Which disease is caused by the spirochete Treponema pallidum, relapsing fever, Lyme disease, Leptospirosis, or syphilis? Syphilis. It is a sexually transmitted infection with stages of primary chancre, rash, and tertiary complications. Which spirochetal disease is characterized by a biphasic febrile illness and is frequently contracted through recreational exposure to contaminated freshwater? Relapsing fever, leptospirosis, syphilis, or Lyme disease? Leptospirosis. It is a zoonotic disease transmitted through water contaminated with infected animal urine. Which disease is caused by the bacterium Rickettsia prowazekii and transmitted by body lice? Q fever, typhus, Lyme disease, or Rocky Mountain spotted fever? Typhus. Epidemic typhus is caused by Rickettsia prowazekii and transmitted by body lice. Rocky Mountain spotted fever is caused by different species. Q fever by Coxiella burnettii and Lyme disease by Borrelia burgdorferi. Which viral disease causes parotitis? Mumps, measles, rubella, or chickenpox? Mumps. It primarily infects the parotid glands, causing painful swelling below the ears. Which viral disease causes a distinctive maculopapular rash starting on the face? Roseola, measles, rubella, or fifth disease? Measles. Measles rash begins on the face and spreads downward. Koplik spots appear inside the mouth. Which viral disease causes slap cheek rash in children? Roseola, measles, fifth disease, or rubella? Fifth disease. Fifth disease, or erythema infectiosum, is caused by parvovirus B19 and gives a bright red rash on cheeks. Which viral disease causes warts on the skin? HSV, HPV, variola, or molluscum? HPV. Human papillomavirus causes common warts, plantar warts, and genital warts. Which viral disease causes cold sores around the mouth? EBV, VZV, HSV1, or HSV2? HSV1. Herpes simplex virus type 1 causes oral herpes, while HSV2 commonly causes genital herpes. Which viral disease causes infectious mononucleosis? CMV, VZV, HSV, or EBV? EBV. Epstein-Barr virus causes glandular fever, mononucleosis with fatigue, sore throat, and lymphadenopathy. Which disease is caused by the reactivation of the varicella-zoster virus later in life? Mumps, chickenpox, measles, or shingles? Shingles. After a person recovers from chickenpox, the varicella-zoster virus remains dormant in nerve ganglia. It can reactivate years later, causing shingles, which presents as a painful, blistering rash along a dermatome. Which fungal infection endemic to the Ohio and Mississippi River valleys primarily causes pulmonary disease? Coccidioidomycosis, aspergillosis, histoplasmosis, or blastomycosis? Histoplasmosis. Histoplasma capsulatum is found in bird and bat droppings. Inhalation causes pulmonary infection. Which fungal disease is also called valley fever? Blastomycosis, Coccidioidomycosis, aspergillosis, or histoplasmosis? Coccidioidomycosis. Coccidioides fungi are found in desert soil. Inhaled spores cause valley fever with flu-like symptoms.